Welcome everyone to our Staying Healthy During the Pandemic workshop.
Bienvenidos todos. El taller es mantenerse saludable durante la pandemia.
Today we're very happy and very thankful to have Dr. Peiqi Wu as our speaker. Dr. Wu is a family medicine physician with over 13 years of experience. He has Western University of Health Sciences Doctor of Osteopathic Medicine degree. He's the owner of a family medicine private practice in Diamond Bar, and he is Herald Christian Health Center's medical director. Here's what we'll learn today. We'll be going over some COVID-19 statistics, how it is spread, what are the symptoms. We'll go over the Delta variant and also prevention tips in vaccination. We'll share how to stay healthy, and we'll also be sharing some community resources.
Lo que aprenderemos hoy, estadísticas del COVID-19, cómo se contagia y cuáles son los síntomas, variante Delta COVID-19, prevención y vacunación, cómo mantenerse saludable y recursos de la comunidad.
Hi, everyone. So I think everybody is probably very familiar with COVID-19 now. This is a novel virus caused by SARS-CoV-2. Started 2019, first reported case in China, and since then spread globally. The World Health Organization announced that COVID-19 has become a global pandemic since the beginning of 2020.
COVID-19 causado por el nuevo coronavirus SARS-CoV-2, primer caso notificado en China en el año de 1919, globalmente extendido, mundial en el año 2020. La Organización Mundial de Salud anunció que COVID-19 se ha convertido en una pandemia mundial.
So a quick update on COVID-19 in the US right now, the case is increasing again. I mean, we probably see that in the news on a daily basis. And from June to July, the number of cases nationwide has increased by more than 300%. The number of cases is still increasing as I'm speaking now, and the highly transmissible Delta variant has also led to an increase in hospitalization and death. People who have not been vaccinated account for the vast majority of the cases and hospitalized cases.
Actualizaciones del COVID-19. En los Estados Unidos, los casos de COVID-19 aumentaron nuevamente después de un periodo de disminución. De junio a julio de 2021, el número de casos a nivel nacional ha aumentado en más de 300% y el número de casos sigue aumentando. La variante Delta altamente transmisible también ha provocado un aumento en las hospitalizaciones y muertes. Las personas que no han sido vacunadas representan la gran mayoría de casos y casos hospitalizados.
So this is a quick graph of the daily cases. We can simply just look at the trend from left is United States, California, and down to the county level. We can see that starting around June, the numbers continue to spike up. And right now is early September, the number is dipping slightly. However, it's hard to say with the coming winter season.
So, los nuevos casos diarios de COVID-19 continúan aumentando, comenzando junio a septiembre 2021. En los Estados Unidos, California, condado de Los Ángeles, han incrementado.
And same thing, you see the same trend in daily new hospital admission, and we can still see the increasing trend. And I'm sure you guys are seeing a lot of news is saying that a lot of hospitals are right now very overwhelmed.
COVID-19, las nuevas admisiones diarias en los hospitales continúan aumentando en los Estados Unidos, California y en el condado de Los Ángeles.
So special mention here, there's also an increased COVID-19 hospitalization among the U.S. children and adolescents since the rise of Delta variant. and it's estimated that for both ages 0 to 4 and adolescents, the increase in hospitalization has about 10 times more than the previous strain.
Aumento de las hospitalizaciones por COVID-19 entre niños y adolescentes desde el surgimiento de la variante Delta. Hospitalizaciones entre 0 y 4 años aumentó de 10 veces. Hospitalizaciones entre adolescentes no vacunados aumentó 10 veces más alto que los que están completamente vacunados. Para prevenir el COVID-19 entre los niños, todas las personas de 2 años en adelante use una máscara en espacios públicos, interiores, escuelas y guarderías. Todas las personas de 12 años en adelante, por favor, vacunarse.
So this is the same trend that we see in daily death, which also continued to increase in the last few weeks since June.
So, esa es la misma tendencia. Las muertes diarias por COVID-19 continúan aumentando en los Estados Unidos, California y Condado de Los Ángeles, y estos son los números.
So note the facts. Beware of rumors and fake news. Check information through official agencies such as World Health Organization, Center of Disease Control and Prevention, Los Angeles County Department of Health, etc.
Conozcan los hechos, cuidado con los rumores y las noticias falsas. Verifique la información a través de agencias oficiales como la Organización Mundial de la Salud, los Centros para el Control y la Prevención de Enfermedades, el Departamento de Salud Pública del Condado de Los Ángeles, y etc.
So how does COVID-19 spread? Mostly through person-to-person contact. Close contact is the main reason that how someone can get COVID-19 from an infected person. And we have to know with or without symptoms. So even if you have contact with someone who is infected, even though they have no symptoms, they might not be aware of it, you can still get COVID-19. Of course, contact with droplets produced when an infected person coughs, sneezes, breathes, and when those droplets are airborne. Other ways that you can also contact the virus is through touching things that's contaminated by someone who's infected.
¿Cómo se contagia el COVID-19? Principalmente a través del contacto de persona a persona. Contacto cercano con una persona infectada, con o sin síntomas. Contacto de gotitas que se producen cuando una persona infectada tose, estornuda y respira. Y aerotransportado. También se puede contagiar de otras formas, tocar superficies o objetos contaminados.
So COVID-19 signs and symptoms. The main symptoms are cough, sore throat, shortness of breath, difficulty breathing. And typically the first symptoms we should see patient having is fever or chill. And most of them do have body aches. Nausea and vomiting and diarrhea may or may not have it. And usually many patients also complain loss of smells or taste.
Signos y síntomas del COVID-19, tos, dolor de garganta, falta de aire o dificultad para respirar, fiebre o escalofríos, dolor del cuerpo, náuseas, vómitos, diarrea, pérdida de olfato y de sabor de boca.
I do need to mention that these symptoms with the coming flu season are very similar to flu. So when you come down with symptoms like that, please contact your primary care doctor. And here the symptoms can appear 2 to 14 days after exposure to the virus. If you do develop the symptoms, please contact your family doctors and get tested. Please stay at home while waiting for the test results. Most people who have COVID-19 only have mild illness and only need to stay at home to recover without needing to go to the doctors.
¿Qué hacer cuando está enfermo? Los síntomas pueden aparecer de 2 a 14 días después de la exposición al virus. Si presenta síntomas, comuníquese con su médico de familia y hágase la prueba. Quédese en casa mientras espera el resultado de la prueba. La mayoría de personas que tienen COVID-19 solo tienen una enfermedad leve y solo necesitan quedarse en casa para recuperarse sin necesidad de ir al médico.
So what to do when you're sick? If you're over 65 years old, have a weak immune system, have other health problems, or your symptoms have worsened, please seek immediate medical attention. If you have any of the following symptoms, you do need to call 911 and be ready to go to the hospital, which including difficulty breathing, pressure pain in chest, bluish lips or face, you're getting very confused, and you're having trouble getting out of bed, or any other severe symptoms that you feel that you're not safe at home.
¿Qué hacer cuando está enfermo? Si es mayor de 65 años, tiene un sistema inmunológico débil, tiene otros problemas de salud o sus síntomas han empeorado, busque atención médica de inmediato. Si tiene los siguientes síntomas, llama al 911. Dificultad para respirar, presión o dolor en el pecho, labios o cara azulados, nueva confusión, incapacidad para despertar, otros síntomas graves.
So if you do have mild illness, you're tested positive for COVID-19, right now there's no known or proved outpatient treatment. I know on the internet you might see a lot of information regarding ivermectin, regarding hydrochloroquine. None of them has been proven to help COVID-19. So my recommendation is be very careful about what you heard, and you probably should go to your doctor and see their opinion regarding any treatment that you might be getting from online.
So, si usted tiene síntomas menores y usted sale positivo, no hay ningún tratamiento que conozcamos que sea adecuado para el COVID-19. Por favor, o sea, aprobado. Por favor, tenga mucho cuidado en lo que usted oye.
Thank you.
You're welcome.
All right, let's talk about the COVID-19 variants. The development of variants are expected as all viruses do. And one example is flu. We have actually different strains of flu every year. So one of the best ways to slow the emergence of new variants is to receive the COVID-19 vaccine to reduce the spread of the virus. And we're really talking about the majority of the population receiving the vaccine, because as long as there is a pool of people who can still get COVID-19 virus, they can replicate and the new variants might appear from there. And all current COVID-19 tests can detect all variants, but will not be able to tell you which variant it is on the report.
Variantes de COVID-19. Se espera el desarrollo de variantes. Una de las mejores formas de frenar la aparición de nuevas variantes es recibir la vacuna COVID-19 para reducir la propagación del virus. Todas las pruebas actuales de COVID-19 pueden detectar todas las variantes, pero no les dirán de qué variante es.
So currently, COVID-19 Delta variant accounts for nearly 100% of all cases in the United States. This variant spread a lot more efficiently from person to person, which may be due to its faster replication speed, higher viral, and easy attachment to lower respiratory tract cells compared to the earliest virus. It spread a lot more efficiently than influenza, SARS, Ebola, and smallpox. This variant also has led to a rapid increase in cases in other countries, including the United Kingdom and Israel.
Variante Delta COVID-19. Actualmente representa casi el 100% de todos los casos en los Estados Unidos. Esta variante se transmite de manera más eficiente de persona a persona, lo que puede deberse a su velocidad de replicación más rápida, una carga viral más alta y una unión más fácil a las células del tracto respiratorio inferior en comparación con el virus anterior. Se propaga de manera más eficiente que la influencia, el SARS, el Ebola y la viruela. Este variante también ha provocado un rápido aumento de casos entre otros países.
So COVID-19 Delta variants may also cause more severe cases than the other variants, other than being more efficient in transmitting. Certain monoclonal antibody treatments are less effective against these variants. However, I do want to mention with the evolvement of COVID-19, we do have better treatment nowadays. It's just that the number of patients is very overwhelming for most of the systems. And vaccine effectiveness, infection only happen in a very small proportion of people who are fully vaccinated, even with the Delta variant. Some breakthrough infection are to be expected, especially among people that are immunocompromised. Fully vaccinated people who do become infected with Delta variant can still spread the virus to other people. All vaccines are particularly effective against severe illness, hospitalization, and death.
COVID-19 Delta variant puede causar casos más graves que las otras variantes. Ciertos tratamientos con anticuerpos monoclonales son menos efectivos contra esta variante. Efectividad de la vacuna. Las infecciones ocurren solo una pequeña proporción de personas que estén completamente vacunadas, incluso con la variante Delta. Se espera que algunas infecciones irruptivas, especialmente entre otras personas inmunodeprimidas. Las personas completamente vacunadas que se infectan con la variante Delta pueden transmitir el virus a otras personas. Todas las vacunas son particularmente eficaces contra enfermedades graves, hospitalizaciones y muertes.
I'm sorry. So let's talk about COVID-19 vaccine. From what I've heard, most of the audience today has received the COVID-19 vaccine, and I thank you for taking that part. So let's talk about vaccine currently authorized by the US FDA, Pfizer. A total of 2 doses given 21 days apart, available to people aged 12 years and older. FDA has changed the emergency authorization to formal authorization for vaccinating people aged 16 years and older. And there are news maybe coming down the pipeline that they might lower the age of the vaccine for younger patients. Moderna, a total of 2 doses given 28 days apart, available to people aged 18 and older. Johnson & Johnson, which is only 1 dose treatment, available to people 18 years and older.
Vacunas para el COVID-19. Vacunas actualmente autorizadas por la FDA de los Estados Unidos. Pfizer, un total de 2 dosis administradas con 21 días de diferencia disponible para personas de 12 años o más. La FDA cambió la autorización de emergencia a una autorización formal para vacunar a personas de 16 años o más. Moderna, un total de 2 dosis administradas con 28 días de diferencia, disponible para personas mayores de 18 años. Johnson & Johnson, un total de 1 dosis disponible para personas mayores de 18 años.
So how does the vaccine work? Mainly through what we call viral vector or RNA. Viral vector is the Johnson & Johnson vaccines. RNA is Moderna and Pfizer. And we do have to note that none of the component of the virus is actually injected into patients. So it's not possible for actually patient to get COVID-19 from the vaccine. And most of these factors or RNA that's injected, by the time the body produces the antibodies, these are all destroyed by the body. So nothing should be left in the body. So, in summary, these vaccines will allow our immune system to recognize the virus and build an immune response so they can fight the virus when we do get it.
¿Cómo actúan las vacunas? El vector viral utiliza un virus inofensivo que se modifica para contener parte del código genético de COVID-19. RNA contiene una versión sintética de parte del código genético del COVID-19 El código le dice a nuestras células que produzcan la proteína de pico COVID-19 que desencadena una respuesta inmune. La vacuna no contiene el virus COVID-19 y la vacunación no hará que alguien contraiga COVID-19. La vacunación instruirá a las células para que produzcan temporalmente una proteína inofensiva. Esta proteína existe en la superficie del virus COVID-19. Esto permite que nuestro sistema inmunológico desarrolle una respuesta inmunitaria y produzca anticuerpos que pueden combatir el virus.
So COVID-19 vaccine, as far as now in the United States, is still free to everybody. Vaccine can strengthen the immune system to help prepare our body to fight against the virus. Again, all current strains of virus, including Delta variants, the vaccines are still very effective, in my opinion. And however, we should continue to wear a mask and maintain social distancing after vaccination, which can further reduce the chance of us getting infected with the virus or spreading the virus.
Vacuna para el COVID-19. La vacunación es gratis. Las vacunas pueden fortalecer el sistema inmunológico y ayudar a preparar nuestro cuerpo para luchar contra el virus. Seguir usando una máscara y mantener el distanciamiento social después de la vacunación puede reducir aún más la posibilidad de infectarse o propagar.
So COVID-19 vaccines, after vaccination, you may have fever, headache, muscle aches, or fatigue for about a day or two. Typically, we see a little more severe symptoms after the second shot. And these symptoms are very normal. And this is a symptoms that the body is building immunity.
Vacuna para el COVID-19. Después de la vacunación, es posible que tenga fiebre, dolor de cabeza, dolores musculares o fatiga durante aproximadamente 1 o 2 días. Estos síntomas son normales. Este es un síntoma de que el cuerpo está construyendo inmunidad.
So for immunocompromised individuals, people who have low immunity may have a weakened immune response to the vaccine. All preventive measures should be followed, which including vaccinations, wearing masks, keeping 6 feet away from people outside the household, avoiding crowds, and poorly ventilated indoor spaces. Situation also leading to possible lower immunity, including transplantation of hematopoietic cells or solid organs, immunotherapy if you're on steroids, or asplenia, which means that you don't have a spleen, chronic kidney failure, end-stage renal disease, or if you're on dialysis, you have nephrotic syndrome. Those are the chronic illness that might lead you to having lower immunity.
Individuos inmunodeprimidos. Las personas con inmunidad baja pueden tener una respuesta inmunitaria debilitada a la vacuna. Deben seguirse todas las medidas preventivas. Vacunación, uso de máscaras, mantenerse a 6 pies de distancia de las personas fuera de su hogar, evitar multitudes y espacios interiores mal ventilados. Situaciones que conducen a una disminución de la inmunidad. Trasplante de células hematopoyéticas o órganos sólidos. Inmunoterapia, asplenia, insuficiencia renal crónica, enfermedad renal terminal, diálisis, síndrome nefrótico, etc.
So CDC now recommends people with weakened immunity to receive a third shot of COVID-19 vaccine, and recommended for people who are moderate to severe compromised immune system receive a third dose of the same vaccine at least 28 days after the second dose of the Pfizer vaccine or Moderna vaccine. The third dose of vaccine should be from the same company as the first 2 doses. And if the previous 2 doses of vaccine are Pfizer vaccines, the third dose of vaccine must be Pfizer vaccine. Currently, there's no recommendation for people who receive Johnson & Johnson or Janssen vaccine to receive a third shot. A recommendation should be made in the coming weeks after more data is collected and analyzed.
El CDC recomienda que las personas con inmunidad debilitada reciban una tercera inyección de la vacuna COVID-19, recomendado para personas con sistemas inmunológicos moderados o severamente comprometidos. Reciba una tercera dosis de la misma vacuna al menos 28 días después de la segunda dosis de la vacuna Pfizer o la vacuna Moderna. La tercera dosis de la vacuna debe ser la misma compañía que las dos primeras dosis. Si las dos dosis anteriores de la vacuna son la vacuna Pfizer, la tercera dosis de la vacuna también debe ser Pfizer. Actualmente no hay ninguna recomendación para las personas que recibieron la vacuna Johnson & Johnson de recibir una tercera inyección. Habrá una recomendación en las próximas semanas después de que se recopilen y analicen más datos.
If you have any of the following conditions, the CDC recommends they receive a third shot. If you've been receiving active cancer treatment for tumors or cancer of the blood, receive an organ transplant and are taking medicine to suppress the immune system. If you receive a stem cell transplant within the last 2 years or are taking medicine to suppress the immune system, you have moderate to severe primary immunodeficiency, such as the George syndrome, Wiskott-Aldrich syndrome. If you never heard of it, most likely you don't have it. Advanced or untreated HIV infections, active treatment with high-dose corticosteroids or other drugs that may suppress your immune response. Please talk to your healthcare providers about your medical conditions and whether getting an additional dose is appropriate for you.
Si tiene alguna de las siguientes condiciones, el CDC recomienda que reciba una tercera inyección. Ha estado recibiendo tratamiento activo contra el cáncer para tumores o cánceres de la sangre, recibió un trasplante de órgano y está tomando medicamentos para suprimir el sistema inmunológico, recibió un trasplante de células madre en los últimos 2 años o está tomando medicamentos para inhibir el sistema inmunológico, inmunodeficiencia primaria moderada o grave como el síndrome de George o el síndrome de Wiskott-Aldrich, infección por VIH avanzada o no tratada, tratamiento activo con los corticosteroides en las dosis altas u otros medicamentos que pueden inhibir su respuesta inmunitaria. Hable con su proveedor de atención médica sobre su afección médica si es adecuado para usted recibir una dosis adicional.
So U.S. Department of Health and Human Services plan to offer the COVID-19 booster to all. However, still pending authorization from FDA and recommendation by CDC. The booster dose safety and effectiveness is still being evaluated at this time. After booster shot has been approved, the booster shot may be offered in the fall and may first be offered to high-risk population, such as patients that's older than 65 years old, who live in long-term care facility, and who are healthcare workers. People who may be eligible starting 8 months after they receive their second dose of an mRNA vaccine, either Pfizer or Moderna. The booster shot should be from the same company as the first 2 doses. Currently, there's still no recommendation for people who receive Johnson & Johnson.
El Departamento de Salud y Servicios Humanos de Estados Unidos planea ofrecer vacunas de refuerzo de COVID-19 a todos. Aún pendiente de autorización de la FDA y recomendación del CDC, todavía está evaluando la seguridad y eficacia de la dosis de refuerzo. Después de que haya aprobado la vacuna de refuerzo se puede ofrecer en el otoño y primero se puede ofrecer aprobaciones de alto riesgo. Personas mayor de 65 años, residentes de centros de atención a largo plazo y trabajadores de la salud. Las personas pueden ser elegibles a partir de 8 meses después de recibir su segunda dosis de una vacuna de ARNM, ya sea Pfizer o Moderna. La vacuna de refuerzo debe ser la misma compañía que las 2 primeras dosis. Actualmente no hay ninguna recomendación para las personas que recibieron la vacuna Johnson Johnson de recibir una vacuna de refuerzo. Habrá una recomendación en las próximas semanas después de que se recopilen y analicen más datos.
So why do we need a booster shot, you might ask? Our current COVID-19 vaccines are still very effective, but after the initial dose of vaccine, protection against infection can begin to decrease over time. The current protection against severe diseases, hospitalization, and death could also diminish in the months ahead, especially among those who are at higher risk or were vaccinated during the earlier phase of the vaccination rollout. Due to the Delta variant, there's also reduced protection against mild and moderate diseases.
¿Por qué necesitamos una vacuna de refuerzo? Nuestras vacunas COVID-19 actuales siguen siendo muy eficaces, pero después de las dosis iniciales de vacunación, la protección contra la infección comienza a disminuir con el tiempo. La protección actual contra las enfermedades graves, la hospitalización y la muerte también podría disminuir en los próximos meses, especialmente entre aquellos que están en mayor riesgo o fueron vacunados durante las primeras fases del lanzamiento de la vacunación. Debido a la variante Delta, también hay una protección reducida contra enfermedades leves y moderadas.
Okay, let's compare the fully vaccinated and the unvaccinated patients. The number of cases, hospitalization, and death are still very much higher among the unvaccinated compared to the fully vaccinated. If you look at the graph underneath, for the cases, there's about 8 times more cases of people that have that they're unvaccinated, and for hospitalization and death, it's about 25 times. So it's still very significant difference. So despite the variants, the vaccines are still very effective.
Totalmente vacunado o no vacunado, el número de casos, hospitalizaciones y muertes sigue siendo mucho mayor entre los no vacunados en comparación con los completamente vacunados. A pesar de las variantes, las vacunas siguen siendo muy eficaces.
So what is the progress for vaccination now? Percentage of people aged 12 and above who are fully vaccinated. For the whole United States, we are at about 62.4%. California, 67.3%. And for the whole Los Angeles County, we are about 66%.
Progreso de vacunación, porcentaje de personas de 12 años o más que están completamente vacunadas. Estados Unidos, 62.4%, California, 67.3%, Condado de Los Ángeles, 66%.
So Herald Christian Health Center, we offer free COVID-19 vaccination at the El Monte Clinic on Tuesday to Friday, 9 to 12:30 p.m. And any walk-in is welcome. The address is 3401 Aerojet Avenue, El Monte, California 91731. We offer Pfizer vaccines for 12 years and up, Moderna vaccine for 18 years and up. And if you do have any questions, call 626-286-8700.
Herald Christian Health Center ofrece vacunación gratuita COVID-19 los martes a viernes de 9 a.m. a 12:30 p.m. Bienvenidos sin cita previa. La dirección es 3401 Aerojet Avenue, El Monte, California 91731. Ofrecemos la vacuna Pfizer de edad de 12 y mayores, vacuna Moderna de edad de 18 y mayores. Para citas o preguntas puede llamar al 626-286-8700.
So let's talk about how to protect yourself and others. So for COVID-19 testing, when should I get tested? If you have symptoms, if you have been in contact with someone who tests positive. And where can I get tested? Well, you can talk to your doctors. You can also call our center at 626-286-8700 regarding free testing. And if you also want to look at more testing location, you can go to the website listed here.
Prueba de COVID-19, ¿cómo protegerse a usted y a otros? ¿Cuándo debe hacerme la prueba? Si tiene síntomas o está en contacto con alguien que dio positivo en la prueba. ¿Dónde puedo hacerme la prueba? Comuníquese con su proveedor de atención médica. Herald Christian Health Center ofrece pruebas gratis. Llame al número de teléfono 626-286-8700. Para más ubicaciones para la prueba, puede ir a covid19lacounty.gov testing.
So if you tested positive for COVID-19, whether or not you are vaccinated or not vaccinated, you should immediately self-isolate, stay at home, but stay at home and stay away from any household members. Do not go to work, school, or public areas. Avoid contact with people. And you do need help finding free delivery service, social services, essential items like food and medicine. Call 211 or visit the public health resources page listed here.
Si dio positivo en la prueba COVID-19, autoaislarse inmediatamente. Quédese en casa, pero manténgase alejado de los miembros del hogar. No vaya al trabajo, a la escuela o áreas públicas. Evite el contacto con personas. Si necesita ayuda para encontrar servicios de entrega gratuitos, servicios sociales, artículos esenciales como alimentos y medicamentos, llame al 211 o visite la página web de recursos de salud pública phlacounty.gov media coronavirus resources, por favor.
So where can you stop the self-isolation? You can stop once 10 days has passed and your symptom from the symptom first started, and you do not have fever for at least 24 hours. And that's provided that you haven't been using any medicine like Tylenol, ibuprofen to reduce fever. And also importantly, your symptom must improve.
Si dio positivo en la prueba COVID-19, debes autoaislarte hasta que han pasado al menos 10 días desde que comenzaron sus síntomas y no tiene fiebre durante al menos 24 horas sin el uso de medicamentos que reducen la fiebre y tus síntomas mejoran.
So other than self-isolation, if you're tested positive for COVID-19, you should immediately tell any of your close contacts to quarantine for at least 10 days. A close contact is defined as people who were close to you up to 2 days before you show symptoms or tested positive. Anyone who was within 6 feet of you for a total of 15 minutes or more than over a 24-hour period. Any person who has unprotected contact with your body fluids or secretion. Again, if you're unsure, anyone that you can think of within the last 2 days, you probably want to call them and let them know.
Si dio positivo en la prueba de COVID-19, informe inmediatamente a sus contactos cercanos que se pongan en cuarentena durante al menos 10 días. Un contacto cercano es cualquiera de las siguientes personas que estuvieron cerca de usted hasta 2 días antes de mostrar síntomas o dieran positivo en la prueba. Cualquier persona que estuvo a 6 pies de usted por un total de 15 minutos o más durante un periodo de 24 horas. Cualquier persona que haya tenido contacto sin protección con sus fluidos corporales o secreciones.
Again, if you're tested positive for COVID-19, but you do not have symptoms, and this applies whether or not you are vaccinated, you must still isolate yourself for 10 days after the test was taken, and also tell your close contact to quarantine for at least 10 days.
Si dio positivo en la prueba de COVID-19, pero no tiene síntomas, debe aislarse por sí mismo durante 10 días después de que se realizó la prueba. Dígale a sus contactos cercanos que se pongan en cuarentena durante al menos 10 días.
So case investigation and how it works. If you test positive for COVID-19, do your part by answering a few simple questions when public health calls. This is confidential, and they probably ask you where you have been, the people you have been around while infectious, and those you have been in contact with for longer than 15 minutes up to 40 hours before you have symptoms. Public health does notify those people about their exposure to the virus, and they probably will not tell them about you.
Investigación de casos y cómo funciona. Si el resultado de la prueba de COVID-19 es positivo, haga su parte respondiendo algunas preguntas sencillas cuando llame a la salud pública. Esta llamada es confidencial. La salud pública preguntará sobre los lugares en los que ha estado, las personas con las que ha estado mientras era infeccioso, aquellos con los que ha estado en contacto durante más de 15 minutos hasta 48 horas antes de tener síntomas. Salud Pública notificará a esas personas sobre su exposición al virus. No le daremos información sobre usted.
So we talk about people that were tested positive for COVID-19. What if you are someone who has close contact with this person that was just recently tested positive for COVID-19? If you are fully vaccinated or you've been tested positive for COVID-19 within the last 3 months and have recovered, what you need to do is you need to monitor your health for symptoms for 14 days, wear a mask when around other people, including those in your household, stay at least 6 feet away from others, wash your hands often, take other steps to protect others. Again, we do encourage you to get tested in 3 to 5 days after exposure, and you do develop symptoms or test positive, what we described in a few slides before, you do have to self-isolate for 10 days.
Si estuvo en contacto cercano con alguien que dio positivo en la prueba COVID-19, si está completamente vacunado o dio positivo en la prueba de COVID-19 los últimos 3 meses y se recuperó. Monitoree su salud para detectar síntomas durante 14 días. Use una máscara cuando esté cerca de otras personas, incluidas las personas de su hogar. Manténgase al menos 6 pies de distancia de los demás. Lávese las manos con frecuencia y tome otras medidas para proteger a los demás y a usted mismo. Hágase la prueba entre 3 a 5 días después de la exposición. Si presenta síntomas o da positivo en la prueba, aíslese.
So what happens if you have contact and you're not fully vaccinated, which including you maybe only get 1 shot of the 2? The recommendation is to self-quarantine, stay at home, but stay away from household members. Do not go to work, school, public areas, avoid contact with people. And if you do need help getting free delivery service, social service, essential items like food and medicine, call 211 or visit public health resources web pages. If you do not develop any symptoms, then you may end your quarantine after day 10. However, you should definitely get tested in 3 to 5 days after exposure. And once the result is back or you do have symptoms of COVID-19, we ask you to self-isolate.
Si estuvo en contacto cercano con alguien que dio positivo en la prueba COVID-19, si no está completamente vacunado, autocuarentena, quédese en casa, pero manténgase alejado de los miembros del hogar. No vaya al trabajo, a la escuela o áreas públicas. Evite el contacto con personas. Si necesita ayuda para encontrar servicios de entrega gratuitos, servicios sociales, artículos esenciales como alimentos, medicamentos, llame al 211 o visite la página web de recursos de salud pública. Si no presenta ningún síntoma, puede finalizar la cuarentena después del día 10. Hágase la prueba en 3 a 5 días después de la exposición. Si presenta síntomas o da positivo en la prueba, aíslese.
Again, to end this pandemic, the only way that we see the light at the end of the tunnel is that we need to do our part to get vaccinated. Other things that we should do, we should continue frequent hand washing, wearing a mask. We should get vaccinated, including those age 12 and above. Hopefully we will get the vaccines approved for younger patients if they're safe. and start doing that. And also we need to continue to maintain a social distancing to avoid crowded gathering and events.
Podemos poner fin a esta pandemia juntos. Lavarse las manos con frecuencia, usar la máscara, vacúnese para los mayores de 12 años, mantenga el distanciamiento social, evite reuniones y eventos abarrotados.
Just a quick reminder, make sure you cover your mouth when you cough or sneeze. Make sure you sanitize frequently any touch surfaces. Monitor your health for symptoms.
No olvide, cubra la tos y los estornudos, desinfecte las superficies que se tocan con frecuencia, monitoree su salud para detectar síntomas.
And we do need to wash our hands frequently, which is really underemphasized. We need to do that before eating or preparing food, after you blow out nose, cough or sneeze, after handling a mask, or going to the restroom. And the best practice to wash your hands are at least for 20 seconds. Wash your hands and lather with soap, rub your palms, scrub your fingers, scrub your thumbs, rub the palms of your hands with your fingers with water.
Lávese las manos con frecuencia, antes de comer o preparar alimentos, después de sonarse la nariz, toser o estornudar, después de tocar una mascarilla, después de ir al baño. Lávese las manos durante al menos 20 segundos. Humedezca sus manos y haga espuma con jabón. Frota tus palmas, frote sus dedos, frote sus pulgares, frote las palmas de sus manos con la yema de los dedos. Lávese las manos.
Even though the hand washing is a little more time consuming compared to the hand sanitizer, but it's still the preferred way to really completely sanitize someone. However, when the soap and water are not available, we do recommend using the hand sanitizer, and hand sanitizer should contain at least 60% of alcohol. And to use the hand sanitizer, pretty much you apply to your palm. You need to make sure you rub and the sanitizer touch all areas of your hands, and then you need to wait until it becomes dry.
Desinfectantes de manos. Cuando no haya agua o jabón disponibles, use un desinfectante para manos. Use un desinfectante para manos que contenga al menos 60% de alcohol. ¿Cómo usar desinfectante de manos? Aplicar en el palma de tu mano, frote los dedos, los pulgares, las palmas y el dorso de las manos. Frotar hasta que se seque.
So how to protect yourself and others from COVID-19? Again, we need to emphasize the practice of social distancing and wearing a cloth face covering. Oftentimes, when you go into a public place, you might see people not practicing that or not wearing a mask. My recommendation is to keep really 6 feet away from them. And if they are someone that you know, you can offer them a mask. If not, I really would stay away from that kind of social gathering places.
Ayuda a protegerte a ti y a los demás del COVID-19. Practica el distanciamiento social. Manténgase una distancia de 6 pies, el largo de 2 brazos de los demás y use una cubierta de la tela para la cara. Asegúrate que te cubra la nariz y la boca para ayudar a proteger a los demás. Podrías estar infectado y no tener síntomas.
So California mask guidance require everyone to wear masks in the following settings. In general, I would say any public places outside your home, you should be wearing a mask. Again, but they specify public transit, healthcare setting, adult or senior care facility, any indoor facility, including the school, childcare, or any state, local correctional facility, detention center, or homeless shelter, emergency shelter, or cooling centers.
Orientación sobre las máscaras de California. Todos deben usar máscaras en las siguientes configuraciones. Tránsito público, entornos de atención médica, incluidos los centros de atención a largo plazo, centros de atención para adultos y personas mayores, en el interior de las escuelas, cuidado de los niños y otros entornos para jóvenes, instalaciones correccionales y centros de detención estatales y locales, refugio para personas sin hogar, refugio de emergencia y centros de enfriamiento. Orientación sobre las máscaras de California. Las máscaras son obligatorias para las personas no vacunadas y se recomienda para todos en lugares públicos cerrados como tiendas, restaurantes, teatros, centros de entretenimiento familiar, reuniones, oficinas gubernamentales, estatales, locales que sirven al público.
So how to choose the right kind of mask? Again, the right kind of mask should have 2 or more layers of washable, breathable fabrics. If they are made of fabrics that's hard to breathe or they are vinyl, it's probably not the best way to put it on your face. Also, if they should completely cover your nose or mouth. Again, some people have the practice of pulling it down so you can breathe easier, but that essentially would defeat the purpose of wearing a mask. And any mask with a valve that allows ventilation probably will not help to prevent the virus. And the mask should fit snugly against the side of your face and shouldn't have gaps at all. Anything that's too big or too small is probably not very efficient or it doesn't help preventing the virus.
Elegir el tipo correcto de máscaras. Máscaras correctas. Tener 2 o más capas de tela lavable y transpirable. Cubra completamente su nariz y boca. Se ajusta perfectamente a los lados de la cara y no tiene espacios. Máscaras incorrectas. Están hechos de tela que dificulta la respiración, por ejemplo, vinilo. Tiene válvulas de exhalación o conductos de ventilación que permiten que las partículas de virus escapen, o demasiado grande o demasiado pequeño.
Which masks are more effective? Any mask is more effective than no mask at all. But again, the worst type of mask that you can wear is something with fabric or a bandana. Anything that's better is including surgical masks, mask that is triple layer with cloth, or surgical mask with cloth, or KN95. The best is N95, but again, that are not very easily accessible, and they shouldn't be reused.
¿Qué máscaras son más efectivas? Peor, máscara de tela de 1 a 2 capas pañuelo. Mejor, máscara quirúrgica, máscara de tela de triple capa, mascarilla quirúrgica más mascarilla de tela que N95. El mejor es N95.
Again, other ways to reduce infection is to maintain a clean environment, which including routinely clean or frequently touched surfaces like tables, door handles, switches, phones particularly, facets, keys, bags, etc. If a household member is sick, try to let the patient use a separate bedroom or bathroom and clean and disinfect all contact surfaces that the sick members might come in contact with.
Mantener un médico ambiente limpio. Limpie de forma rutinaria las superficies que se tocan con frecuencia, las mesas, cerraduras de puertas, interruptores, teléfonos, grifos, lavamanos o bolso, etc. Si un miembro del hogar está enfermo, trate de dejar que el paciente use un dormitorio o un baño separado, limpiar y desinfectar las superficies de contacto.
Again, food safety should be also mentioned here. A lot of people are really worried about the food, things they buy from grocery markets might contain COVID-19, which are pretty rare. The risk of spreading COVID-19 to food or food packaging is very low. Again, we should avoid using household cleaners like your soap, like your detergent to clean your fresh fruits or vegetables, and just wash with water instead. Or you can soak it in water with running water for 5 to 10 minutes. Wash your hands with water and soap before and after handling this food.
Seguridad alimentaria. El riesgo de propagar COVID-19 a través de alimentos o envases de alimentos es bajo. Evite el uso de limpiadores domésticos o jabón para limpiar las frutas, verduras frescas. Lávelas con agua en su lugar. Lávese las manos con agua y jabón antes y después de tocar los alimentos.
So the following points are extremely important during this pandemic, which is to take care of your mental health and well-being during the pandemic. Observe whether your stress or worry affects your diet, sleep, work, mood, or health. You need to take care of your health, including a balanced diet. You need to regularly exercise. And very importantly, you need to get sufficient sleep. You need to avoid overexposure to news or media, which a lot of us are. And you need to keep in touch with family members or friends via phone, video conferencing.
¿Cómo cuidar su salud mental y bienestar durante la pandemia? Observe si su estrés y preocupaciones afectan su dieta, sueño, trabajo, estado de ánimo y salud. Cuide su salud, dieta equilibrada, ejercicio regular, sueño suficiente. Evite la sobreexposición a noticias y otros medios. Manténgase en contacto con familiares y amigos por teléfono o videoconferencia.
And let's say you are overwhelmed or really stressed out. The key is you have to make time for relaxation or for your hobbies. And the idea is not relaxation hobbies, is to make time. Focus on what you can control. For one, get vaccinated if you are not. Wear a mask, maintain social distance, and take care of your health. Things that are not within your control, try to not focusing too much on it. Otherwise, it will get to you. Again, if everything is beyond your health, you should also get professional help, including counseling, therapy, or there are many community resources that we'll share in a little bit with you guys.
¿Cómo cuidar su salud mental y su bienestar durante la pandemia? Tómese un tiempo para relajarse o para sus pasatiempos. Concéntrese en lo que puede controlar, vacunarse, ponerse una mascarilla, mantener la distancia social y cuidar su salud. Evite concentrarse en cosas que no puede controlar cuando se termina la epidemia. Busque ayuda profesional, asesoramiento y terapia. Busque recursos comunitarios.
So I guess everyone wants to know what they can eat to become more healthy. So it's not about eating certain food to try to improve immunity, but it's about having healthy eating habits. So any kinds of vegetable and fruits that are fresh, they are grown, they are not processed. Any whole grains, which including whole wheat bread, pasta, oatmeal, etc. Help healthy proteins like skinless protein, chicken, fish, beans, nuts, and tofu. Things that we call so-called comfort food that are usually high in salt, oil, sugar, they're usually fried, they are usually highly processed. We should reduce the amount as much as we can. And things, supplements that we can also use to help boost our immune system, including vitamin D and vitamin B12. And very importantly, we need to stay hydrated. And that usually including at least 6 to 8 glasses of water or fluids a day.
Una dieta saludable ayuda a reducir el riesgo de enfermedades. No se trata de comer ciertos alimentos para tratar de mejorar la inmunidad, sino de tener hábitos alimenticios saludables. Todo tipo de verduras y frutas, cebollas, espinacas, pimientos, marrones, setas, naranjas, granos integrales, pan, pasta de trigo integral, avena, proteína saludable, pollo sin piel, pescado, frijoles, nueces, tofu. Limitar, evitar alimentos con alto contenido de sal, aceite, azúcar, alimentos fritos o muy procesados. Coma con regularidad comidas pequeñas y frecuentes, suplementos según sea necesario, vitamina D y vitamina B12. Manténgase hidratado alrededor de 6 a 8 vasos de agua por día.
We do have to remember that with the vaccination, we do rely a lot on our immunity to fight the virus. So these are the healthy habits that we talk about: exercise at least 30 minutes a day, at least 3 days a week, get a vaccine. You need to get sufficient sleep. If you're smoking, using marijuana or drugs, you should quit it. We should limit the amount of alcohol we drink. And of course, see your doctors to do your annual physical exams and do any routine preventive screening as recommended.
Los hábitos saludables aumentan la inmunidad. Haga ejercicio al menos de 30 minutos al día durante al menos 3 días a la semana. Obtenga las vacunas recomendadas, duerme suficiente, dejar de fumar marihuana o drogas, limitar el alcohol, realizar exámenes físicos y anuales, realice exámenes preventivos de rutina según lo recomendado.
And these are the community resources that we're sharing. Again, our health center, 626-286-8700. We provide COVID-19 testing. We provide the vaccines. We do help with health insurance enrollment, food stamp application, and behavioral health. Department of Public Service number 866-613-3777. Provide cash assistance, food stamp, job search assistance, and etc. LA County website, which is listed here, and also LA County Department of Health mental hotline, 1-800-854-7771. You can also call 211 for more resources, which including low-income housing, employment services, legal consultation, and childcare, etc.
Recursos de la comunidad. Herald Christian Health Center, el número de teléfono es 626-286-8700. Prueba y vacunación COVID-19, inscripción de seguro médico, solicitud de CalFirst, salud conductual. Departamento de Servicios Sociales, el número de teléfono es 866-613-3777. Asistencia en efectivo, CalFirst, asistencia para la búsqueda de empleo. La website del Condado de Los Ángeles, el Departamento Mental del Condado de Los Ángeles, el número de teléfono es 1-800-854-7771. Llame al 211 para obtener más recursos de vivienda para personas de bajos ingresos, servicios de empleo, consulta legal y cuidado de niños.
Well, I can't tell you how much I wish we can end this pandemic right now, but only way to do that is we need to do this together. And there's no tricks. There's no special way we can get this, or there's no special medicine that right now they are seeing. The only way we can do this is to do this together by getting vaccinated, by wearing a mask, by wash your hands often, by keeping a social distancing as much as we can.
Podemos poner fin a esta pandemia juntos. Vacunarse, usar máscaras, lávese las manos con frecuencia, mantener el distanciamiento social.